An increasing number of measles cases. The centre, in fact, has asked states to consider administering an extra dose of the measles and rubella vaccine now to all children aged between 9 and 5 years, particularly in vulnerable areas where they're falling sick and having to be hospitalized.
Recently, we've seen an increase in the number of cases, and it's not just from Mumbai, but also from districts of Bihar, Gujarat, Haryana, Jharkhand, Kerala, and of course in Maharashtra, where over 500 cases have been reported so far.
Let's go across to Sohit at this point. Sohit, quite a spike in the daily cases in Mumbai yesterday. One more death of an infant also reported, an 8-month-old. What steps are being taken now to fight this?
Well, Mumbai on Wednesday recorded 30 new cases of measles and 1 death related to the infection. This is based on the report given by the PNC. As many as 30 new measles patients were admitted to civic or state-run hospitals in the city during the day, while 22 patients were discharged. And 156 measles cases were found during the BMC survey. Now, all of these things are coming forward because there is a lot of on-ground surveys as well as awareness programs and drives that are being run by the BMC. And that is exactly what the BMC officials are also saying, that along with awareness, what they are doing is they are running drives as well as the vaccination camps are being run in several places where they are seeing outbreaks happening. As of now, there are 17 outbreaks in the city, and that's why now the focus is on how the vaccination process could be fasten up and how that they increase it. Now, if you look at the pattern, what has happened is majority of the cases that are coming are of the children who did not take the vaccination. Basically, the vaccination is given first when the child is 9 months old, and the second vaccine is given when they are more than 15 months old. But majority of the cases that are coming positive are of the child or of the children who did not take vaccine at all. And that is why there is no herd immunity as well, because there are several such locations across the city where majority of the children did not take the vaccine, because of which there was no herd immunity that could be formed over there, and that led to the rise in cases. And this has also to do with the last year's COVID cases, because the parents feared to get out of their houses. Apart from that, there were several rumors regarding the vaccines, after which now special drives are being taken by the BMC. But yes, the number of cases, if we compare to the last 2 years, have increased. One of the reasons is that the last 2 years, because of COVID as well as due to lockdown and several other reasons, many of the children did not step out of their homes as well. So yes, a lot of reasons are coming forward, and now several drives are being run by the BMC to ensure that majority of the children, the number of those children who are unvaccinated is around 20,000. So they get vaccinated, and they are also trying to ensure that the awareness, as well as if someone has any issue, they report it to the BMC officials as soon as possible, so that there could be action taken as well as they could be treated as well.
Right. Thank you so much, Sohit, for joining us with all those details. Ankita, the COVID pandemic is one of the major reasons for the, lack of vaccination amongst children, especially aged 9 months
and
to 5
years. And that's exactly what the World Health Organization has also now red flagged in a warning. It said the imminent threat of measles spreading in various regions globally because of the decline in vaccine coverage in the COVID-19 years is now a major global threat. They've talked about how measles is one of the most contagious human viruses, but preventable through vaccination. 40 million children, it seems, missed measles jabs in 2021. And the WHO has talked about how the world is now at a crossroads, and that the next year to 2 years could be particularly challenging.